At the Bondi Clinic, bird expert Josh Cook has shattered the peace with a screaming baby. The little sulphur-crested cockatoo was found on a nearby golf course after plummeting 20 metres from his nest.
He wouldn't have lasted, overnight without a fox or a dog or a cat eating him. So, yeah, he was lucky to be found.
There's a very strange sound coming from the waiting room.
Josh has named the noisy cocky Kettle for obvious reasons.
Josh.
G'day, Chris.
How are you?
Yeah, good, mate. So I've got this little cocky who's pretty glad to see you too.
He doesn't look too glad to see me. Look at him.
No.
And you can see pretty clearly compared to the other good leg, that one's hanging pretty limp. You've got to be thinking break. But my fear is there may be more than one break, and there could also be a dislocation in either that knee joint or the ankle joint. Either way, it's a serious injury. You look at Kettle and he's the absolute picture of vulnerability. He's small, he's skinny, he doesn't have any feathers to his name, and he's lost and alone. And he might have a fractured leg. He's in a bad way.
Oh, listen to that heart. It's beating so hard. Yes, it is.
At the Bondi Referral Hospital SASH, Denise from the rescue group Pause has brought in a 1-year-old orphan called Olivia.
Her heart, it's just pounding. It's pounding. If the room was silent, I believe you'd probably hear it. That's how loud it is. I think this little girl's in serious trouble. She could not be rehomed because, she's got this problem. The pound cannot sell her. So death for her, that's it.
Hey, beautiful girl, shall we have a listen to your heart? She's got a really loud murmur. It's okay, Bubby.
Emergency vet Lisa Chimes immediately takes Olivia for an ultrasound to confirm her diagnosis.
We grade these murmurs out of 6, and she's got a murmur that's a grade 6 out of 6, so that's the highest. It's just tragic. A heart murmur means that there's an abnormal blood flow in the heart, and if we don't treat it, that blood volume going in that abnormal direction is going to put an extra strain on her heart muscle, and she will go into heart failure, and she will not survive more than a few months, a year, probably max.
I don't want to imagine anything is going to happen to her, and I'll probably start crying about that, but she's alive and she's going to stay that way. Aren't you? Yes, you are.
The operation to fix this heart murmur will cost at least $3,000.
We ask for donations, and whatever isn't covered, I will cover myself.
Wow.
You deserve to have some more time to live a normal life, don't you? Yes.
He's not known for his silence, Kettle, so it'll take a fair bit to subdue this beast.
Chris's cranky patient Kettle needs his leg x-rayed. The squawking chick is lucky to be alive after falling out of his nest.
Oh, he looks so defeated. That's the fracture we're obviously looking for through there. The fortunate thing for Kettle is that he's probably got one of the best bird people in the country on his side, and if anyone's going to nurse him through this, it's Josh. All right.
How'd he go?
Yeah, so he certainly does have a fracture there.
Yep.
It's a longitudinal fracture, so it's not straight across.
Oh, okay.
It's sort of at an angle,
right,
across the bone like that.
Yep.
But it is only one fracture. It's been a real blessing. The trick's going to be whether we can actually get this to heal.
Yeah.
The big concern I had from the start was how much nerve damage Kettle had suffered in that foot from that injury. He's still not really clenching his toes. He doesn't really have that perching reflex. That's got to start appearing soon. Otherwise, Kettle really doesn't stand a lot of chance of being released back to the wild. Flew out of a tree, broke your leg, stuck in the hot sun, and you had to put up with me. It's a rough day, isn't it? He is about to get better though.
At the Bondi Clinic, Chris must find a way to set Kettle's tiny fractured leg.
This will be very delicate.
Okay.
Incredibly hard to do, these splints. For these sort of procedures, we use some very high-tech equipment.
Okay.
Okay. So they mightn't look like much, but between a set of chopsticks, a paddle pop stick, and a plunger, I can pretty much fix any bird's leg. Just try me. So I think that syringe plunger might actually be the winner.
Okie doke.
So it'll just cushion him if he tries to walk on it. If anyone ever thought they had a bad day, they should look at you tonight, Kettle. Look at you. You're having a terrible one.
Kettle's saviour, bird carer Josh Cook, may just have the answer to silence the pint-sized screamer.
You like that, do you? Still whistling. More, but look at this. Look at this. You fool. Did it stop the whistling? No. Not even close. Seem to rest, little buddy. I'm going to be seeing a lot of Josh over the next few days and then over the next few weeks because these sort of things, they require constant monitoring. There you go.
Okay.
No problem.
See you, Chris.
Thanks, mate. I'll see you soon. If that splint's too tight, it'll cut off the circulation to his toes and that'll really inhibit healing. But if it's too loose, then that bone's going to keep on moving and the bone won't start to mend. Get that? Whew. It's still here.
Hello.
Hi Lisa, how are you?
I'm good.
This is the
How you-
big day.
How you
Next day at
feeling?
Sash,
Oh, very
Denise
nervous.
brings in Olivia for the procedure which will hopefully repair her heart.
Good. Everything will be all right. You know, this poor dog has had no luck. It's time that her luck changed. And hopefully it will change now.
Okay.
Cardiologist Dr. Rita Singh will be performing the delicate procedure on Olivia's critical heart murmur. The condition is also known as a PDA, a patent ductus arteriosus.
There's a little bit of tension, nervous energy here today because this is a fairly new procedure at SAT. Traditionally, we've always fixed a PDA by cracking open their chest and tying off that blood vessel. But now we're going to try a newer technique where we don't even do surgery. We just feed like a plug up one of her vessels and plug it off from the inside. Fingers crossed it works.
I've got to do very carefully, so it's taking me a little bit of time.
If this new technique fails, surgeon Andrew Marchevsky is on standby to perform traditional open heart surgery.
The problem with her is she's a really little dog with a really big abnormal vessel. And because of that, we can only get quite a small plug up her artery into her heart. And the plug size that we can get up there may not be big enough to actually plug the hole. And if that's the case, then it's back to me.
Here we come. So it's coming now. See, it pulled through. Yeah, it's too small for it. I'm just going to try once more, but I think this is going to be just too small.
Rita has to be really careful here because if there's one wrong move, it could tear through her vessel and she could bleed out. So it's pretty risky, pretty fiddly, and there's a lot of pressure on here.
It takes way longer than I expect it's going to.
Cardiologist Dr. Rita Singh is struggling to block the faulty vessel in Olivia's heart.
Well, I'm going to try to push the plug in now, but as I said, I think it's not going to work.
despite Rita's doubts, the plug is finally in place.
Yes. We're going to keep our fingers crossed the next 24 hours now and we'll see.
I'm getting a little bit excited now.
Finally, I'm going to let you get excited.
Yay, Rita!
Just when the team is starting to celebrate,
Let's put you to bed.
suddenly Rita notices a change in Olivia.
I think it's moved.
Really?
I can hear a continuous murmur now.
Their joy has turned to devastation.
Poor dog. Oh.
We're just in complete shock here. I mean, everything was looking so good and Olivia was recovering, and then in a second she moved too much and the murmur's back. The device didn't work. It's really disappointing.
That's it. It has to be surgery now. I thought we were done. I know she was going to be fine.
So she's just over here, having a little rest.
Hello.
After the anaesthetic.
Later that afternoon, a shattered Denise is allowed in for a quick visit.
Can I pick her up?
Yeah, you can pick her up.
Very, very distressed. Really distressed. Yeah. Didn't want to open her chest if we didn't have to. We took the easy option, but it didn't work. So now we go for the hard option. So you've got one more chance. One more chance, hey?
Hello. How are you? G'day, Sophie. How you going? Hey, mate. G'day, Ron. Hey, Sophie. How are you? This is Farley, isn't it?
It is Farley.
Hello, Farley. How are you? You good? Speak. Good.
Meanwhile, Chris is keeping a special date at the Children's Hospital in Sydney's West. He's made a promise to help one of Australia's most inspirational little girls, Sophie Delezio.
Do you want me to get it out?
Sophie has just the most incredible story. I'm sure everyone's heard about it. A car crashed into her childcare centre and caused her to have third-degree burns to 80% of her body. She lost both of her feet, but the staff here at Westmead, they saved her life.
And this is its kennel. Put the dog.
Now, Sophie has her own Day of Difference Foundation to help other critically injured children.
Is this Jack?
This is Jack, yeah.
Today, she and Chris are handing out Tara dolls, named after Sophie's first assistance dog.
My dad thought that it would be a good idea to call the dog Tara as a remembrance of my dog. She was a good help to me and I really do miss her.
From the same litter, I reckon.
Sadly, Tara passed away 2 years ago. Sophie's now waiting to get another four-legged helper.
Drop, roll over. It's a high 16. I never cease to be amazed at the impact that pets can have on kids, and when they find themselves in horrific situations where they're going through a lot of trauma, a lot of pain, an animal just can soften that whole experience. And that's why I'm so behind pet therapy, because it does work. It really does make a difference. Can I do one more?
Yes.
Charlie, speak.
I was so mad. It does help blocking your ears. Makes me feel really happy that they have something to enjoy while they're in hospital.
No worries at all. It's our pleasure. And the look on their faces. They forget about everything else and just see this little puppy dog in front of them, and that's what it's all about. You know, just for those few seconds, nothing else matters.
Hello, puppy.
No pressure today.
No.
None.
Last chance in, huh?
2 days later, Olivia is back at Sash for her second heart operation.
The buck stops with you.
Yep. This is the last chance for her. It's either going to work or she'll die, you know. This is a really big heart, and this is this abnormal vessel. So we're just going to dissect around this and tie it off, and then immediately everything will start going in the right direction. It doesn't take much dissection in slightly the wrong plane to dissect through the heart. If that happens, it's all over. It's delicate.
At SASH, the open heart surgery on rescue dog Olivia has reached the critical stage. The pressure on surgeon Andrew Marchevsky is palpable.
All right, I'm just tying it off now. All right. Goosebump moment. Yeah. She's fixed. It's pretty exciting, huh?
I knew you could do it, hero Andrew.
Thanks, Lee.
You're amazing. You're my hero. As composed as Andrew was, you can even see it in his face. He has really breathed a sigh of relief that this is over.
She's going to take a few days to become good, but well, I think Olivia will find a home now because she should be just a normal, trouble-free dog.
Good to see you, buddy.
Yeah, likewise. Come on through.
Thank you.
It's a big welcome for Chris at Josh's bird menagerie.
Here he is.
Kettle, the screaming cockatoo, is ready for his final checkup.
Look at you. That's fully dressed now. That little boy's grown up.
This is how Kettle looked when Josh first brought him into the clinic after the baby broke his leg. What a difference 2 months has made.
Should we take the cast off? Look at that. Nice and straight.
Moment of truth.
Oh,
Nice work.
shake it off.
In a few more months, the lucky cocky should be ready for release.
Where's the whistle gone? Yeah, you're a bit proud of yourself, aren't you?
Who's this? Oh, look, here's your new mum and dad. There you go.
As for Olivia, she's made a full recovery. Her foster mum Denise has found the orphan a permanent home with Terry and Spen.
Oh, I miss her heaps. I will. She's such a lovely little dog. But she's ready to go.
We couldn't have wished for anything better.
Isn't that lovely? She's perfect, isn't she?
She's gorgeous.
And she loves you.
It is emotional. She's going to be the sunshine in our life.